Well, the term mental health has become a catch-all excuse for just about everything, and many in the field encourage a victimhood mindset by offering a safe space for patients to air their grievances, making therapy attractive to those who seek validation. And then there's the political factor. According to research from Stanford, 88% of psychiatrists are Democrat donors. So how does that impact care? Joining me now is psychotherapist and author of Therapy Nation, Jonathan Alpert. Jonathan, great to see you. So you believe that the therapy office has become a political battleground that's contributed to dividing us even more. You've also mentioned that graduate classes are training therapists to see things through political lenses, marginalized, privileged, et cetera. How does that help a patient who actually needs real health care?
Yeah, and that's a great point that you're making. It unfortunately doesn't help patients, and we have these graduate programs that are breeding grounds for social justice warriors, and they are categorizing people into rich, poor, white, black, gay, straight, trans, this, that, and they're moving so far away from the core issues that therapists should be treating, depression, anxiety, and instead they're sorting people into these boxes and categories. And in my book, Therapy Nation, I tell the story of a patient, a black professional who sought help elsewhere for issues around stress and anxiety, and his therapist made everything about him being black. And she said, well, you must have issues as a black man at your company. And she focused entirely on that, and he felt disrespected and he felt offended, and he ended up leaving that therapist. And another story that I tell is of a gay man, very similar situation, very similar story, where the therapist focused entirely on him being gay. And she said, well, as a gay man in America, you must face X, Y, and Z. And really, he didn't. He just was facing ordinary issues that a lot of people face that bring them into therapy.
Yeah, you mentioned ordinary issues. There's been this pattern of categorizing everyday tasks, everyday challenges as toxic or trauma. People who, maybe push back and say, have you thought about taking some personal responsibility for this or changing your lifestyle in this way? They're accused of gaslighting. So as a society, given the mentality that you just talked about in training psychiatrists, are we perpetuating a victim mentality that makes these issues worse?
Yeah, the mental health profession really is perpetuating problems, and what it's done is turn ordinary life experiences and struggles into pathology. So let's say you have a bad day at work, or you're just feeling blue for a day or a week. Therapists have a tendency to call that depression. That's not depression. In a similar way, let's say you forget an appointment or you're a little bit disorganized, a therapist may call you ADHD, and that's not ADHD. It takes a whole lot more than that to properly diagnose someone. Or if you have an ex-boyfriend that's a jerk, suddenly that person becomes a narcissist. So none of this is true, and these very serious clinical terms are being misused.
Well, Jonathan, we are grateful to talk to you, and there are people out there who need real mental health care, so certainly they should get your book, Therapy Nation,
Thank you,
and follow you for some advice about getting real help. Jonathan Alpert, thank you for joining us. Great to see you.
Thanks, Katie. Take care.